Guys, welcome back to my channel. My good name is Mimosa the nurse. If you're new here, kindly hit the subscribe button, give me a thumbs up, comment and share. Don't forget to like. So today I want to talk about nurse-patient relationship. I'm sorry guys, I've been away, been having very long schedules, but I'm back. So one will ask, what is nurse-patient relationship? So in simple terms, I will define it as an interaction between a patient and a nurse in enhancement of their well-being, or a sick patient to get better, or that relationship or that bond that you create with your patient so that you can help them to get better. So what are the characteristics you're supposed to have as a nurse so that you can enhance that good bond or the strong bond between you and your patient? First of all, you have to have active listening skills. You have to listen more and talk less. And then you have to have power in your words, or rather facts. What you tell your patient is supposed to be very true and you should have researched so that you don't lie, because the moment you lie, that's when you're going to break your bond with your patient. The next thing you're supposed to have is professional intimacy. By professional intimacy, I mean you're supposed to be very ethical and you maintain that professional boundaries between you and your patient. The next thing you're supposed to have is be empathetic. Be able to put yourself in that patient's shoe so that you can be able to explain the situation, or rather you feel what they're feeling, or rather you try to embrace what they're feeling or what they are going through. Let's talk about the phases, or how you get into a relationship with your patient. First of all, you have the pre-interaction phase. This is where a patient comes to the ward, or rather to the hospital, and that is your first encounter with them. So you take their history so that you can have a clear picture about the patient or what they are ailing from. The next thing is orientation. Your patient is supposed to be oriented or be oriented of the surrounding, or where they are going to stay for that time that they are going to be in that hospital, or rather that home-based care setup. You have to tell them, or you have to orientate them. This is, for example, this is the kitchen, this is the washroom, all that. And then the next phase is working phase. This is where you're going to work on your patient. That is, maybe you're administering drugs, maybe you're taking vitals or blood pressure, or maybe you're doing the IV fluids administration. So that is where you're going to win your patient's trust. Though you're supposed to win it on the pre-interaction phase, because first encounter matters. The last phase is termination phase. This is where your patient gets better and they are being discharged from the hospital, so your relationship gets terminated. And that brings me to the next point. So how do you end this patient-nurse relationship? So you have to reach to an understanding, or rather a mutual understanding with your patient after your goals have been met, and then you celebrate the goals. Why am I saying celebrating the goals? Your patient came in when they are very sick, and now they're living where they are very healthy. So that is a celebration, or that is one thing, or the goal that has been met, and hence makes you to celebrate with your patient. And this is where you're going to end your relationship, or you're going to terminate that. So someone will ask, are nurses allowed to date their patients? So no, nurses are supposed to maintain their professional boundaries, or rather uphold their code of ethics very, very high, and sexual behaviors are not allowed with current patients. So guys, thank you for tuning in and watching the whole vlog. I hope I've informed 2 or 3 people, and thank you for always coming back and liking my videos and leaving a comment. Till next time, bye bye.